Firstly, thank you all for joining us. Probably after the pandemic or in the middle of a pandemic, this is the first time we all have gathered to witness an event which caters to all of our lives. To witness an event which defines every aspect of our existence. If we see the curve of human civilization in the last 15, 20, 100, 200 years, there are remarkable events which have changed the way human societies live. One such change was the advent of technology. Around 200 years back, technology fundamentally changed the way human civilizations thrive. Around 50 years back, internet came into existence and all of us got hooked to what we call a connected world. 2-3 years back, one good thing, or probably the only good thing that came out of the entire pandemic, was the country embracing the idea of technology. In the last few years, the smartphone coverage, the acceptance of any technological solution, and any form of intervention that eases the existence of human life on this planet has been widely accepted. People have more access to it, and there has been increased awareness for any such solution. I may do an error, but nonetheless I will continue in the same path and say that as first motorboat arrived and people felt that it is not going to change anything, but it changed the way people traveled. As the first airline flew, and it fundamentally changed the way people travel across the world. Telemedicine is that solution for India's public health problem. Today we are here to witness the launch of India's first telemedicine solution that is run by a non-profit at zero cost. Thanks to our partners at EXA, thanks to people who participated in the pilot run across the last few months, thanks to the technology providers, thanks to the hundreds of ASHA workers who provided us the feedback, thanks to the people who benefited with it, and thanks to everyone who created an enabling environment for NGO to think of this, dream of this, and make this possible. We are today here for the launch of SAATH. SAATH stands for Supportive Action across Telemedicine and Health. Every word in this phrase is very unique. It talks about supportive action. It does not about action on its own or its entirety. It talks about an action which is in its existence to support existing institutions, existing ideas. It talks about telemedicine, it talks about health. It starts from a small bit of telemedicine which is like a meta layer across the primary healthcare sector, and it talks about health as an overall idea of well-being. Today we have with us Dr. Jitendra Singh ji, who represents this idea in entirety. He is a doctor himself, he has been a practicing doctor. People who know him, whoever I have interacted with him, of course much older to me, I've always referred to him as Dr. Saab. And he has been in the public life for decades. Currently leading our science and technology ministry for Government of India. As a perfect fit in all dimensions, from a practicing doctor to being in public life that brings him to awareness of public health systems of the country, and the Minister for Science and Technology. It's a pleasure for us to welcome him today afternoon for the launch of SAATH.
Honorable Minister of State for Prime Minister's Office, and of course Science Technology also. अक्सा इंडिया के CEO श्री अंकुर जी, country head, Shri Direk ji, भाइयों और बहनों, आप सबका इस कार्यक्रम में हार्दिक स्वागत है। आज विशेष दिन है। आप सब जानते हैं, our honorable Prime Minister has passionately named this as Sewa Din, because all his life he had been serving the country, and now he goes beyond. Sewa International has two dimensions to serve. Indian diaspora has reached almost all the countries across the globe, and wherever they go, whichever way they go, they have succeeded like none else. That's how Indian diaspora is called the most vibrant diaspora world over, the most successful. The very idea of Sewa International started with engaging the diaspora. As diaspora prospers, as diaspora succeeds, as diaspora in all the walks of life, they are all over and they have reached all top places. However, our earlier Prime Minister Atal Bihari Vajpayee, in his first address to the Pravasi Bharatiya Divas, he said, हर भारतीय जो भारत के बाहर जाता है, थोड़ा सा भारत साथ में अपने हृदय में ले जाता है. The spirit of India he carries all wherever he goes, and he keeps connecting to the mother country. As diaspora rises, we are requesting them to engage in local charity. And diaspora has done it successfully. Like all over the globe, last year, when we did not suffer, Bharat did not suffer as bad as other countries. We had some shocks and jerks. But beyond that, nothing more. But wherever Indian students were there, all of a sudden, universities were closed down, colleges were shut, hostels abandoned or stopped. They had nowhere to go, the students. And as you know, Indian students are in all countries. Sewa International was the first to reach them, support them, arrange for their temporary stay, their food and everything, and involved Indian community into it. This happened in USA, this happened in Canada, this happened in UK, European countries, Australia, New Zealand, and wherever it be, wherever students are. It happened like that. So that was the. However, in USA, Sewa International USA did a marvelous job. This happened in other countries also, but this was remarkably successful experiment. They involved that all they invited all diaspora organizations working in USA to join hands to serve local community. And believe me, out of 800 organizations that we appealed to, 500 responded to that. They joined hands and collaborated in serving the local American community. They supported the doctors because we have hotels and motels. I supported the hospitals, they were there. Doctors had no time to go travel back to home. So you can stay here, you can have food here. Everything was there. Nurses like that. The firefighters were like that. The policemen were served. The frontline workers were thus served in all countries. And it happened in other countries also. And that's how Indian community as a unit would serve, rise to the occasion, serve the local populations in many countries. That's one job that we the Sewa International does outside Bharat, outside India. But the other part is within Bharat. The diaspora feels that they should also contribute a little, whatever might they can, to the development through non-governmental organizations. So we select non-governmental organizations, screen them, and then we present their projects to diaspora. Diaspora supports that effort in many ways. And this is going on for last 24 years since this is established. We were all over there and we did marvelous job. I should not say that in a way that anyone can say, but then it happened like that. Like during the tsunami, it was impossible to construct houses outside India, and we did it. 200 houses in eastern part of the Sri Lanka, Ampara and Batticaloa districts, in 2 villages. We did. This happens everywhere. This happens in USA, where Houston, during the Houston deluge, 2016, we are asked to serve the local community and asked to build houses. And believe me, Red Cross USA contributed $500,000 to that. Google contributed 2 million and more, and it goes on. And we constructed 24 houses for the Cambodian community that had migrated to USA. And that's where the Sewa International role comes in. So it's here, the diaspora engagement and beyond. During this year's COVID, the COVID-2, everybody knows, and of late, the certification has come from no one else but the President of United States, Joe Biden, who has appreciated the activity of Sewa USA as well as Sewa International. That happened because all the whole Indian community stood shoulder to shoulder with Sewa International USA to serve the Indian population, and we could get, of course, it's all countries together, 12,000 plus concentrators right in time. It was a difficult time. There was pressure. We were getting phone calls right 24/7. And our volunteers, and this was the building which is witness to that activity. Volunteers used to sleep here, they had food here, they worked all 24 hours. They wanted beds, they were arranged, they wanted oxygen cylinders, they were done. Concentrators, whatever is needed was arranged, organized, and not only here, across the country, through 700 plus organizations, partner organizations of Sewa International. So that was how it happened. And today, we're at the second stage of the activity. I'm very glad, I'm delighted that, as Shubhamji has said rightly, this is an innovation that we are trying to get into serving the people. The kind of the size of India and the population, 1.3 billion people, it's difficult to reach 7 lakh villages otherwise. But it can happen, and technology can, of course, make it possible. And that's what this effort is. We're thankful to AXA for joining hands with us in supporting this endeavor. And this came out, as a matter of fact, this idea came from AXA, and we were ready to accept it. And I appreciate the spirit of the CEO of AXA, Ankurji, that he came up with the idea through some friend. We started talking, and here we are today. After so many deliberations, it took a lot of discussions to come up with a program that will reach at least, to start with four states, and we might expand. So I thank you all for joining this program, as well as I thank today's guests and our partners at SAATH. Thank you very much, and namaste.
This event is about discussing the future. Telemedicine as a solution is a solution of the future. And we have Clemens joining us from France, who is here with us as a global CEO of the AXA Life She will be sharing her message, her plans for AIMSA, her plans for India, and how she sees this entire initiative. I request the team to get her.
It is with great pleasure that I announce our efforts in India during the COVID-19 pandemic to make telemedicine and virtual care more accessible, affordable, and acceptable. Many families in the country have seen difficult times from the threat posed by the lack of overall access to healthcare facilities and doctors. Many people got infected with COVID-19, and some fell sick due to other medical conditions. At a time like this, we have seen patients' hesitancy to seek treatments at the hospitals. The fear of getting infected has even pushed people to self-medicate. With support from local NGOs, our strong team in India has launched a free telemedicine hotline for families living in the states of Delhi NCR, Haryana, Maharashtra, and Rajasthan. The initiative is called SAATH, named for the word togetherness in Hindi. The hotline, Supportive Action Across Telemedicine and Healthcare, SAATH, is a joint corporate social responsibility initiative between AXA entities with local operations, including AXA France India Reinsurance Branch, AXA Go Business Operations, and AXA XL in India. SAATH aims to provide telemedicine services for medical ailments and information on the availability of critically needed healthcare supplies in response to the COVID-19 crisis in India. It will connect people to doctors, including general practitioners, Ayurvedic doctors, and nutritionists. Through SAATH, we aim to increase acceptability, affordability, and accessibility to telemedicine and virtual care. We hope to make an impact in the new phase of better healthcare practices across India. This effort also further demonstrates AXA's commitment to enable access to healthcare for the most vulnerable and to support the Government of India's virtual care initiatives with the National Digital Health Mission. I am pleased to see Honorable Minister of Science and Technology, Dr. Jitendra Singh, among us today. We are indeed proud that there is immense support for new initiatives in the country. His role has been instrumental, and we are honored to have him launch the Project SAATH. Dr. Jitendra is also a physician, and I look forward to hear his view on telemedicine and the future of virtual healthcare. Many thanks to all of you.
Better way than having two doctors talk to one another. So I request Shubhamji to dial the number and share it with Dr. Jitendraji. Jitendraji, we would request you to talk to our telemedicine number. The number is visible here, and I will request Shubhamji to pass on the phone. And you can just call up and get connected to a doctor while we hear your conversation.
Connect me to a doctor for a diabetes consultation.
Okay, sir. Before proceeding further, I would like to inform you that this call is being recorded for training and quality purposes. I will transfer your call to doctor. Before that, I need you to register a case of yours, and for that, I need some of your basic details.
Please go ahead.
May I know your first name, sir?
My first name is Jitendra.
Could you speak louder, sir? I'm not able to
Jitendra,
hear.
Jitendra. No, we want to understand some of the preventive measures to keep away diabetes.
First of all, do you have any members in family who have diabetes?
No, we don't have, but we are a couple of friends who have some family members who already have. So we would just like to educate ourselves how best to avoid it.
To every day, like 25 to 30 minutes walk for don't get excess weight.
Thank you.
And then if you watch to diet also, don't take outside junk food and everything. It's okay to have some time like in 15 days or 8 months. It is okay, but don't go for regular ones.
Thank you.
And yes, and every 6 months or 1 year for diabetes, proper medical checkup. So maybe in this diabetic condition, you may know that you will get or not.
Thank you very much, doctor. Basically,
It affects a large part of our population, but is often not talked about much. Thank you, Jitendra ji, for also using the launch of SAATH to spread awareness.
this could be an awareness.
Yes, sir. Thank you so much for uh, building this small creative element to the whole launch of SAATH. Thank you so much. As we saw the launch of SAATH, at the end of the call, on the email ID provided by the patient, we also get a prescription that ensures that the entire time cycle and the life cycle of the patient and the launch is met. Uh, Overall, when we talk about such initiatives, they are very small or meager compared to the size of India. But in terms of the impact that it creates in the way the future of the country is shaped up, it is tremendous. Today, we are going to talk about a very interesting topic from, we will hear about the topic from Dr. Jitendra Singh, is about the public health challenge of India. In the COVID-19, the entire world saw the rise and the rising awareness on the issue of public health. USA today has more than 2 lakh cases that are currently there, despite active vaccination campaigns. India has been vaccinating almost daily on more than 80 lakh patients. More than 80 lakh people are getting vaccinated every day. We saw a huge number of cases rising and then immediately getting controlled with the active juncture of efforts between the government, civil society, and people coming together itself. The topic today we are going to hear from Dr. Jitendra Singh ji is the topic that is very close to his entire life and close to everyone present here. He is going to share his views with us on the public health challenge of India and the technology solution. As a Minister of Science and Technology and as a doctor himself, I welcome Dr. Jitendra Singh ji to share with us his views on the topic. Welcome, Dr.
आदरणीय श्याम जी, जो कई वर्षों से हमारे साथी भी रहे हैं, सहयोगी भी रहे हैं, और जब भी कोई दुविधा संकट का समय आता है तो उस समय याद भी नहीं किया। इस तरह के हमारे संकट में and the Sewa International owes a lot to him, his dedication, hard work and consistent efforts. And I was myself one of the beneficiaries of his dedicated effort during the COVID times, when we had to raise some assistance for northeastern region of India. Also seated with us, Mr. Derek and Ankurji and all the friends. At the outset, I think I have to congratulate you for a program which is being held at the right time. Today, as Shyamji was telling you, happens to be the birthday of our dear Prime Minister Shri Narendra Modi. And incidentally, both the subjects are close to his persona, Sewa and science. He, as Shyamji was saying, has dedicated all his life to Sewa, service of the nation, service of society, service of humanity. And at the same time, he is one who has a natural temper for science, as a result of which for the last 7-8 years, ever since he's taken over the reins of administration, there's been a huge boost in every area of scientific activity in this country. Whether it is atomic energy, whether it is space technology, and what we are going to discuss today is also related to space technology, which has virtually entered every Indian household. Today, the pictures that are procured by our Mangalyaan mission are being also obtained by America's NASA. That is the kind of advancement that we have made. And in spite of the fact, if you think in the context that our space journey started much later than many other countries. For example, when we launched our program under Sarabhai somewhere around 1960 or so, Soviet Union and the USA were already on the verge of landing on moon. But we have taken over in a big way. That is a huge tribute to the scientific capabilities which were waiting to be realized, and Prime Minister Modi gave them the kind of push that they were waiting both in terms of financial allocations, the support, the encouragement. And not only that, our recent mission of Chandrayaan discovered the presence of water on the surface of Moon. So that's a sterling example. So I always say in lighter vein that America was the first to land a human being on the surface of Moon called Neil Armstrong. And all of us as children saw those visuals also, you walking around having a stroll on the surface of Moon. So I say he walked around, but he did not notice water. Just many years later, one of our missions went and captured the picture. So it is because of Prime Minister Modi that we have a huge science technology based temperament in the country, in every field. And at the same time, the country has realized the importance of service and seva, not only as a matter of faith, but also in an institutionalized manner. And now, in the COVID pandemic, we learned the entire nation, inspired by Prime Minister Modi, dedicated itself to the service of humanity. Now, I have been asked to talk about telemedicine and also about the challenges. I also have to compliment and I have to thank Shyamji and the entire team for making me a part of this and giving me an opportunity to launch this appropriate program on an appropriate occasion. So I don't think there could have been a better thing happening to me than this on this day. So I have to, from the bottom of my heart, thank you for that. As the name indicates, supportive action across telemedicine and healthcare. The matter of fact is that telemedicine as an option was known to us, say about at least a decade and a half or nearly 2 decades ago. And in my setup, institute where I worked, we were among the first to set up a telemedicine chamber also. We used to use satellite communication. But it was never put to optimum use because our temperament was not tuned to that. And I think one of the remarkable things that has happened during the pandemic is that we have suddenly realized the enormous virtues of telemedicine. As they say in English that every adversity is accompanied by a virtue. So I don't mean that we should continue with pandemic. But one of the good things that pandemic has left behind is that we have got awakened to the enormous applications of telemedicine, which I am sure even when the pandemic passes off, in the post-COVID era, will come handy. Particularly for a country which is as heterogeneous as India, which is as large as India, which is as spread out as India, where you have difficult terrains and difficult topography spread from north to south, east to west, northeast, and one region is unlike the other region. So you have problems of accessibility. I tried starting a helicopter service in North, helicopter ambulance, which I gather that concept. In Australia, you have flying doctors. So, one issue is that of accessibility. In the urban areas, many of the patients get over-treated because you just walk into a heart institute, complain of some irritation here. Whether you have a heart disease or not, you'll come out with 1 or 2 stunts inside. They make it a point not to send you back without a return gift. So I was telling this to Tran and all, because all of them my friends. Whereas on the other hand, in the rural area, patient remains undertreated. Even if he gets a heart attack and he deserves to be attended in that golden hour, 1 hour, he doesn't have. Now this is the answer to that. And with the kind of technology available today, of course, when we started all this telemedicine all over the world for 2 decades, okay, it might not have been available today. Through the telemedicine, you could send across your ECG, you could send across your echo, you could send across all your other investigations electronically. And the doctor could also feel your pulse and your heartbeat, replacing the use of the conventional stethoscope, and then also could prescribe you the medicine. So that is one part of it. The second is, after accessibility, the availability of the right kind of doctor. You might be living in an urban area, but you might not be having availability of a concerned specialist who would be best suitable to treat you. Because nowadays, we live not only in an era of specialization, but even in the era of super specialization. Now, for even each specialty, for example, in diabetes where I am dealing with, you have pediatric diabetologists, you have pediatric endocrinologists. Tomorrow you may have ophthalmologist, one for the right eye, one for the left eye. You may have left eye specialist, right eye specialist. So you might have to inquire which eye requires treatment. Then you have, earlier on we used to have orthopedics as a specialty for both. Now we have knee replacement orthopedicians differently, hip replacement different. Tomorrow you may have one for the right knee, one for the left knee. Because the knowledge explosion is happening. So to get the best treatment which you want or a patient wishes to is not easily possible even if you have the resources or capability or the amount to pay. And there again comes in telemedicine. So this is the second again big answer that telemedicine has. You can connect to any best super specialist doctor across the globe. In fact, I have already tried this very successfully in the COVID times. In one of my constituency districts, we set up a small chamber in a district hospital and we connected with all the panchayats. And I said, no, we don't need to do much. Even the panchayat got anybody, because everybody nowadays knows how to operate these links. You don't need even literacy. If you go to the remotest part of India, you come across the most illiterate person who may not know the alphabet ABC, nothing. He can teach you how to use WhatsApp. So the digital literacy is something different. So you just need anybody, any helper can. And that experiment proved so successfully. In that district, all my panchayats are connected to specialist doctors, and each time, every 2-3 days, we keep on upgrading the panel of doctors, including more and more specialists per se. So first accessibility, then availability. And third, which is unique, for which I have to compliment Shyamji and the Sewa International, is the cost effectiveness. So you may have availability, you may have accessibility, but then how to shell out the kind of amount that is required. And that sometimes also leads to not only cost effectiveness but over effectiveness. As I said, you walk in, you say I have some irritation here, and you come back with 3 more stunts, even you may not have deserved that. But if it's a free going on, they will not do that, because they know they are not going to earn anything. So they will tell you, gentlemen, you don't require a study, because उसको लगता है ऐसे डाल दिया पैसे नहीं मिलेंगे. And it's also a huge service to those who can't afford it. So availability and accessibility to the best of medical consultation, to the most super specialized consultation without having to spend a penny is, I think, what should be told everybody as the hallmark of this launch which is happening today. And as was being mentioned, this is going to be a countrywide free telemedicine facility. To begin with, I was told they've already into it in the 4 states of Delhi, Haryana, Rajasthan and Maharashtra. Then they'll go southwards, and maybe in 6 months the entire country will be. So I think it's a huge, huge relief. And as I always say, we cannot leave everything to the government. So I think you have done what maybe government was looking forward to do, or the health ministry was looking forward to. So you have come as a great support to them. So that is one advantage. Now the other part of it, as you were saying, the challenges. See, in the last 20-30 years, we were mostly faced with non-communicable disease, because the spectrum of diseases, the epidemiology of diseases anywhere in the world keeps changing from time to time. So there was a time in India which Shyamji and I have seen, many of you might have, when most of the people died of tuberculosis, plague, cholera, because you didn't have enough medicine for that, enough treatment for that. The first antibiotic came in around 1948 or so, which is known as the queen of drugs, penicillin. The first line of anti-tubercular drugs led by streptomycin came in the early 1950s. And before that, there was no treatment, just sanatorium treatment. खुली हवा में छोड़ दो, थोड़ा सा कीटाणु भाग जाए. And India was the worst affected because we were a tropical country. After say about 1980 or so, all that was over. We had the superior 40 and 35 COVID. And then like the Western world, we also got into an era of non-communicability. So the entire concentration, entire energy, entire resource went into this. And these were the diabetes mellitus, heart disease, coronary heart disease, dyslipidemias, your with advancing age, because the lifespan of Indian has also gone up, malignancies of the late age. And suddenly this pandemic came in. And our young doctors were not prepared. I was telling my students that they said sometimes they feel guilty, we didn't teach you infections enough because in the last 20 years you were hardly dealing with infections. We were talking to you mostly about diabetes and heart disease. But overnight they oriented themselves. So that speaks volumes of the inherent scientific capability of an Indian brain. Only thing maybe which was lacking was policy planning and priority at the level of the ruling dispensation. And that gap has been beautifully filled by Prime Minister Modi. So this was the right time to happen this. Now, as Shyamji also mentioned that I am also looking after science and technology in the government. I think I'll use this opportunity also to announce one more launch that we could do. We have envisaged a program called Jigyasa, wherein we would be setting up scientific facility in the schools where it is not available. Mostly in the government schools, across the country. And as he said, that we have about 7 lakh villages and about 700 odd districts. We've already gone into about 170 districts. I think by the end of this year, or maybe the beginning of next year, we'll be covering almost all the 700 odd villages, 700 odd districts of India. And this idea also came to me because I did a small experiment about 4 years back in my own constituency. There was a small government school which did not attract many admissions because parents usually prefer going to private schools, academies. But I realized that the faculty and the staff in the government school was actually better than the private school. Because in the private school, you can even engage a class 12 person to teach class 12. Nobody is going to ask you. And you are not going to pay anything. You might get a check signed for 1,000 rupees and pay only 100. But here, the selection, especially the 10 plus 12 level, is through a proper process, through public service commission. You have to be a postgraduate, everything. But maybe the infrastructure was not. So with the help of some NGOs, one of them an international NGO, we set up the most upgraded form of science facility there, along with the computers, internet, everything. And also the upgraded toilet facility, which Modi ji always stresses but which was never taken care of earlier. Particularly in the government school, they thought toilet is not required, you can ease yourself anywhere. Indians are capable of doing that. So for Indians, the toilet is not required. That was the concept for them till some years ago. So when we did that, next year we realized that there were at least 40 to 45 young children from the private schools who had migrated to this school. So I said we have created a new phenomenon of reverse migration. Usually migration happens from the government school to private. So I think we can do it. We have an infrastructure which need to reinforce. So through this Jigyasa program, we will cover almost all the 700 odd districts of the country where we provide children. And the later stages in these schools, as you know, you also have a mechanism of periodic health checkup for these students. When I was a schoolboy, Shyamji was a schoolboy, the checkup was mostly for malaria, and even if you did have, they asked you to gulp down chloroquine, which was as a school command you had to gulp down, whether you had it or not, as a preventive. Now, since as the doctor was also mentioning, periodic testing, prevent. So that if we have the science facility equipped in the schools, then the telemedicine facility, maybe through Sewa International, would also get integrated to provide that component. So it's going to be a very healthy synergy. And I'm sure in the days to come, because I'm not going to take long, because this has been my subject all my life, and I was actually paid for lecturing for many years. I was a teacher for more than a quarter of a century. So I can go on and on till somebody rings the bell. But to conclude, I would say that in the times to come, our entire programs, projects whether they are infrastructure, whether they are agriculture related, whether they are education related, whether they are related to construction of roads, buildings, or even railway lines, are going to be entirely based on technology. And therefore, science technology, which was considered to be a very important area in the government in all the Western countries, some of our priorities were not very much at place till Modi ji made us realize. So this is going to be the basis of this, and I am glad. Before I conclude, I wish to compliment again Shyamji and the entire team that you have actually become pioneers today by launching one of the first of its kind country-wide free telemedicine facility to mark Sewa Divas, the birthday of Honorable Prime Minister Singh. So thank you very much and compliments once again.
He talked from the lens of leading a major ministry. He talked from the lens of being a teacher. He talked from the lens of just more experienced person in life. And he talked from the lens of just being a good friend of the people, of the nation, as well as for all of us at Sewa. Thank you, Dr. Jitendra, for being and enlightening all of us on the just idea of life to the idea of healthcare. I would just request Ankurji to come and interact with all of us. In my interactions with Ankurji, I have always enriched in my understanding of policy, to my understanding of India, to my understanding of healthcare, to my understanding of insurance sector, to my understanding of how to just work with people. He is going to talk to us about the future plans of EXA France in India, the whole idea of building an integrated healthcare system, and his plans for SAATH. Welcome, Ankurji, and look forward to listening to you.
Thank you, Honorable Mr. Jitendra Singh ji. I think we are very thankful for him to inaugurate SAATH. Thank you, Sewa International, Shyam ji, Shubham ji, and all friends from media and other colleagues. For EXA, it's a very proud moment that we are launching this project SAATH. And this project, I would say EXA is conceived when we, I think, first started talking to Shyam ji. It was more like a COVID ballroom. When COVID hit India, I think second wave, none of us were prepared. And I think there's no shame in saying that we could not expect this could happen. We started discussing a war room, and by the time we discussed it, we had so many communications internally also. And this is the first EXA group project, so all three entities of EXA were working together, and we took our time. By the time we decided, COVID second wave was over. So then this project turned into what is next. COVID is maybe the second wave is gone, but what is next for India? What does EXA think? How EXA can contribute together with Sewa? So we thought that the concept that is taken off after this pandemic is virtual care. Telemedicine, as I was saying, has been there for ages, and in the insurance industry, we have tried our best to ensure that people call telemedicine doctors, but it's never taken off. But this pandemic changed everything. Suddenly, we figured out that we can't send doctors everywhere. Telemedicine was the only solution. Virtual care is the only solution that we have. So we figured out that, okay, maybe if we focus on telemedicine to be the pillar, focus on three things: affordability, accessibility, and acceptability. So taking these three pillars into account, we said that we should launch a free telemedicine helpline. So this project that started today is just the start. It has generic consultation, Ayurveda, homeopathic, and nutrition. But we plan to include other specialties also. So, and this project is going to evolve as per the feedback of everyone. It's not perfect. It's not perfect at all. Maybe it's quite cumbersome to go through the initial calls also. So we are looking for feedback. But this project will evolve into a comprehensive virtual care. So what we plan to do also in the later months is expand the number of states that we cover, go hopefully across India with other partners, like other corporate groups also coming along with us with Sewa International. But launch an app through which you can book free medication. Not free medication, you can book medication that's delivered at your door. You can book diagnostic tests delivered at your door. You can book specialist appointments also. So everything, healthcare, it will be at your door. We want you to use it. People are afraid to go to hospital, no issues. Use this and book medicines, get tests, get your entire health records into your app. And then we would like to integrate this with the National Digital Health Mission, because I think Indian government under the leadership of the Prime Minister Shri Narendra Modi has been at the forefront of using technology for governance. I think in this entire pandemic also, and after that also, the focus on technology has only increased. And technology has brought transparency also. So, as I said, this is a supportive project. This is evolving. If you want, people tell us these things need to change, we will add more things to it. And this project is going to be integrated with other partners who like to come on board on this. EXA in India has been one of the largest employers. EXA is the biggest insurance group in the world. And we have our reinsurance branch here. We have insurance companies also in joint venture with the Bharti Group. We have two of the biggest back offices in India, EXA XL back office that is in Gurgaon and Bangalore. And we have EXA Global Business Solutions, which is in Pune and Bangalore. So we have a large presence out there, and Indians in the EXA group, that's a significant number. So all of us want to contribute to this. We want to do something that will make an impact. So healthcare is one of the areas EXA is very focused. And what we plan to focus on India is to maybe focus on primary healthcare. Today, if you see on the insurance side, I think it's mostly secondary and tertiary. What we plan to do is we plan to bring primary healthcare, primary insurance or comprehensive healthcare at a very cheap price. But we can bring that only if people accept technology. So that's what our ambition and our focus out here is. We also, what we feel is that today in the rural India, the problem of accessibility is there, affordability is there, but acceptability is a big issue. People do not accept telemedicine. And for that, you need a partner who has presence on the ground, partner who's credible, who knows the ground. And that is where for us Sewa International comes. And it is Sewa's entire work in the pandemic has been exemplary. And we believe with Sewa, we'll be able to reach out to the rural villages, urban slums, and across the geography of India. And we believe that this project is just the start of various initiatives that we can bring on the healthcare side. I again thank Shyamji, the Honorable Minister, Shubhamji, and all the friends out here and all the media out here for coming on this event. Thank you.
We are also pleased to have Mr. Derek with us. So far in our engagements, we have very often missed out on the key elements between stakeholders. One of those elements is trust. The kind of trust AXA has showered upon us throughout the process, during the engagements, in the due diligence, while engaging with the team, while engaging with coming up with the name. They have ensured complete trust on us, and that kind of freedom when any on-ground organization gets, they feel empowered, they feel magic. And that's why we have, when we were deciding the tagline for AXA, we have mentioned empowered by AXA. And that is all because of the trust that AXA has provided with us. And I would request Derekji to please come over here and share with him his views and his ideas on how we have come to this launch of SAATH and his plans ahead.
Thank you. Hi, good afternoon everyone. Shyam, thank you very much for inviting us to the launch, and obviously very pleased to have Dr. Jitendra here as part of the launch. For me, I'm not going to say a lot, but I just want to talk about the amazing collaboration that we've had to get this launched. There's been collaboration actually just within the AXA group. As Ankur said, we have many different entities. The global operations, AXA XL, which is the commercial division of AXA Group, and AXA Reinsurance. And even though we are a big company, and maybe because we are a big company, we actually don't collaborate that much. And then this was one opportunity that came up that got us working together. And this word collaboration keeps coming back because we then had to collaborate with Sewa, who are a fantastic partner for us, and then also collaboration with the government. And I think this strong collaboration is something that, in a way, you could say the pandemic was a catalyst. Because as the second wave, we're right in the middle of the second wave, the AXA Group companies got together and said, if we try and do things individually, we won't be successful. Here we were thinking about how could we good and do something collectively. And we thought about trying to get oxygen manufactured or getting oxygenators out, and we all thought time would run out and that we didn't have the time to do that. I have to take my hat off to Anko because it was his idea and it was his vision to say, listen, let's go down the route of telemedicine. It's not a temporary thing. It's innovative and it almost reflects the energy in the country. So with that idea and working with Sewa, who've got this fantastic outreach, we're able to have this very exciting launch today. So with that, I want to thank the teams. I want to thank everyone who's collaborated together. And most of all, I really wish to see this being hugely successful. One of the things is, whilst I think we're in the early days, the big thing is how much usage we get. And that's why I think we would like to get help from the press, help from all our partners, so that we just see a huge amount of usage. And as Anka said, this is just the beginning of the journey. And we hope that this journey continues so that we have greater usage, greater facilities, and greater help to our communities. So with that, thank you very much, and congratulations to everyone. Thank you.
We also have with us a video message from Sebastian. Sebastian is one of the partners for this entire initiative. He currently leads the global business operations for EXA. Overall, in any insurance sector, or any sector for that matter, the team which is presented on the front, the team which represents the organization on the front, is a team which interacts with the clients. And Global Business Operations for EXA is that team. And we are glad to have his video message with us. He has been with EXA Group for more than 9 years now. And we would love to hear what Sebastian has to offer to us. Over to you.
Happy and excited at the launch of Project SAATH. At every level, we are passionate about enabling our community in multiple ways to respond to the COVID-19 pandemic and health-related solutions in India. We have always been at the forefront of taking care of our communities since our expansion in India. This initiative further strengthens our commitment to health and disease prevention, our KCSR pillar. SAATH is the next milestone in this journey. I'm very happy to be linked to SAATH and confident that this will go a long way in combating the far-reaching consequences of COVID-19 and other diseases.
Mantra's part that speaks about health, which is Sarve Santu Niramaya. Basically, it's a quote from Riddhanayak Upanishad, which talks about that everybody should remain disease-free. Though we should all aim for that, but it's not something that we can assume that it will happen without keeping a good health, without keeping, ensuring that we are eating right food, getting the right treatments, etc. So I'm very proud to be with all of you distinguished guests who have been here and who have spared some time to come here on this Friday afternoon on this auspicious occasion of our Honorable Prime Minister Narendra Modi ji's birthday, which is celebrated as a Sewa Divas today. SAATH's concept, as has been spoken already quite a bit, came about when we launched our covidsewa.com, which is a portal that we developed and ran during our second wave of COVID, during which we addressed around 800 plus complaints that we were running through our portal, and it was then discussed how we can scale it up and how it can be made into a service which is not only for this particular pandemic, but it can be something which can be run over a long period of time, addressing requests and health concerns of many more people across the country. And then when we got across to know about from EXA that there is some interest of developing such a application, such a telemedicine service, we thought it's the best way we can address the challenges of our country. So with that, I would like to thank our guests who have come all the way and spared some time to address us today, starting with Honorable Dr. Jitendra Singh ji, Minister of State for Science and Technology, for launching the SAATH app, as well as guiding us about the things that government is doing already in science and technology and how the things have been changing for the betterment for the health, science and technology for our country, and how we can all be partners with the government, private sector, social sector. All of them can come together and work with the government to reach out to the remotest part of the country. Next, who has come here and talked about the collaborations and different ways how EXA foresees this collaboration to go through with Sewa International. how we can, just starting with 4 states, we can expand it to many states across the country. And the service, which is right now limited to a telemedicine number. So thanks a lot, Ankurji. Next, I would like to thank Mr. Derek Nazareth, country head for EXA Excel, for especially his focus on how we can expand our work and how different EXA entities came together for this noble initiative, which in itself was a challenge, as you mentioned. And how when we see a problem, this COVID second wave showed how different entities can come together, whether private sector, social sector, government sector, can come together and address a particular problem in a way that can help and reach out to the most needy people. So thanks a lot, sir. Lastly, but not the least, Mr. Shyam Parandeji, our global coordinator for Sewa International, who has been a guiding force for us since the beginning, since I joined Sewa International, and also has been one of the key figures who has been leading the global initiatives across India, whether it's through disaster or through engagement with the Indian diaspora. So he has guided us through thick and thin of times and helped us to get encouraged and not get disheartened, especially such calamities like COVID-19. I got COVID during that time, and he was literally, driving this whole effort on his own. So I know that because his energy, though he seems, pretty old right now, but he has the energy of a young person. So I can tell you for that for sure. So thanks a lot, Shyamji. We hope to have your blessings forever. So with that, I would also like to thank our media partners who are very short notice came together and made this happen and covered this whole event with such a in such a professional way. And also thank Mr. Kumar Shubham and the whole team to present and do such a great event both online and offline, despite having resources and very short notice. We just came to know about the final date just 2-3 days back. So it's quite a remarkable achievement that they did. So thanks a lot, and I could also see some of the EXA partners also are there. So I'd like to thank them also who have joined, for this event. So thanks a lot to all of you for coming here. Thank you.